The broadcast is now starting. All attendees are in listen-only mode.
Good morning, good afternoon, and welcome to this new webinar organized by the Maternal Health Supplies Caucus of the Reproductive Health Supplies Coalition. We have started on time, but people are still joining. So let's give our participants a few more minutes, 2 more minutes to join. I see people are coming in, so just a second. Just a second, people are still coming in. Let's give them some time. Okay, 1 more minute and we will start. We have all our presenters here, so we're good to start, but people are still coming in. All right, so welcome to this new webinar organized by the Maternal Health Supplies Caucus of the Reproductive Health Supplies Coalition. You are all muted in order to prevent background noises. This webinar is being recorded and a link to the audio and the video will be sent to all members of the caucus in a couple days, including the presentation. We will not open the microphone, but you are most welcome, please, to write your questions in the questions box at the right-hand side of window of your GoToWebinar platform. Without further ado, let me introduce Rolinde Baker. She's from Check2Gether, and she's going to introduce our presenters today. So welcome, Rolinde. The microphone's yours.
Hello, everybody. It's great to meet you all. Milka, thank you very much for the warm welcome. It's really a privilege to meet you all today to tell you more about our solution, Check2Gether Antenatal Care for mothers that need it most. I would like to introduce Loan Liam. She is a program manager of Simavi. She is our partner. We co-created Check2Gether together. And my colleague Maurits van der Heijden, they will explain to you and present to you our solution, the impact, and what we did so far. And we're looking forward to have a fruitful webinar with you and looking forward to the discussion. And I would like to give the word to Loan.
Oh.
Can I see the next slide?
Yeah. Sorry. Yes. Oh, I have some difficulties with sharing my screen. Do you see the next screen?
I see the first slide.
Yeah. 1 sec. Ah, here it is.
Thank you.
Yes, because as you see, we were supposed to present with the 3 of us. In the middle, you see Rudolf from Ghana. Probably he has some problems with the internet. So these are the 3 presenters of today, if Rudolf will be joining. So Maurits, maybe you can say something about TNO.
Oh, sorry. TNO is a research institute in the Netherlands, and I am a system engineer, and I'm involved with the development of Check2Gether.
So Rudolf is the program manager from Presbyterian Church of Ghana Health Service, very familiar with the Check2Gether and has been implementing this project since a few years. Myself, I'm Loan Lien, working for Simavi, which is an organization based in the Netherlands, working for health and water and sanitation. Next slide.
Yeah, I do have some issues with going to the next slide. 1 sec, I will try again. Why is it not working?
Maurits, maybe if you close your camera.
Yes.
Yeah.
No, it should be okay now.
You might want to close your camera so it's better for you.
So the audience can see the outline, what we are going to present in the first 25 to 30 minutes. We will, the video, which we might do at the end. We will say something about the Check2Gether, how we developed it, in what kind of context, and how it has been working in Ghana. Then we will discuss the Check2Gether Kit in detail, what is inside, how it works, and what are the advantages. Then TNO will present what is the current status of piloting this innovation and how we would like to scale it up to create impact. And the last half hour after our 30 minutes presentation, we will have a discussion with the audience. Let me see.
No, it does, the video doesn't work. We skip the video.
Yeah. So what was our challenge? Now, why was the Check2Gether developed? Our challenge was how can we improve maternal health in countries which are having some problems and low indicators. And this device was developed to be used in low resource setting, where the maternal health and the neonatal health indicators are poor. And the problem in that setting would be that the distances to the clinic is an obstacle for the mothers to access the services. They don't have time, it's too far, the means of transport is difficult. The antenatal care services are incomplete due to gaps or challenges. For instance, there are no lab services. It's also developed for a setting where there is a shortage of qualified staff to do the antenatal care, and in a setting where anemia, preeclampsia, diabetes in pregnancy is not well diagnosed. So what is the aim of the Check2Gether? It screens risk factors. It can be used during outreach and just near to the homes and under a tree. Now this device, first we have been piloting it in Ghana, but Ghana, although it has some relatively good indicators, the indicators on maternal mortality rate, infant mortality rate, and neonatal mortality rate are rather poor. But in this country, there are huge disparities between urban and rural areas. So we have been piloting this Check2Gether in an area where the indicators were very low, and it was also a very rural area. The doctor and nurse ratio in those areas, it was even lower than what was presented generally in Ghana. And the distance to the health centers was almost up to the 16 kilometers for women to access services. 45% of the antenatal care clients have to pay, despite the maternal care is free. It was to the clinics, but also because of transport. And all clinics are suffering from lack of simple equipment. Now in Ghana, we tested it because we also saw that there are good opportunities, because the insurance coverage is more than 67%, and more than half of the health institutions are community institutions, which is Ghana's strategy to reach everybody. Then in Ghana, you have a progressive health policy that also encourages health solutions, so that was very good to the fit of our innovation. And the global expenditure in Ghana, or the Ghana expenditure, is quite low, quite lower than global, which also was attractive to introduce this one as a simple, low-cost device. Now in this slide, you see how our work is aligned to the vision of WHO. And the table in the middle shows the two components to improving the quality of care in a WHO model. At the left side, the blue side, you see the provider side, where the Check2Gether Kit is positioned. It improves routine care, management of complications, supporting referrals, and links to the health information system. I will tell you some more details how it works. And at the right side, the orange side, WHO includes the client experience. And Simavi and TNO are combining the Check2Gether Kit together with group care during antenatal care visits. And through this approach, pregnant women will have more benefits compared with individual care. And we will also briefly provide some more information about group care. Next slide. Here you see the picture of the Check2Gether. The backpack has 4 components, and it's meant for screening pregnant women during their visit. They are primarily focusing on preeclampsia, postpartum hemorrhage, through measuring anemia and gestational diabetes. This together is responsible for more than half of all pregnancy-related complications. And I mentioned that this kit is adapted for Ghana because it also screens for urine tract infections following the national guidelines in this country. Now, the number 1, the BP machine, is a special machine because it's validated that women themselves can measure the blood pressure. Number 2 is an hemoglobin machine, and this is an innovative device where you can measure the HB without a finger prick, but by just putting a sensor on the finger of the pregnant woman. Number 3, the urine dipsticks, that it might be familiar to you. And this one is simple, only measures protein, sugar, and whether there is an infection. And all this information is going to number 4, which is the tablet. And if you insert the information, instantly there will be advice on referral, treatment, and urgency, as you see the colors, based on the analysis and data of the measurements and the national standards. So the urgency is also expressed in the colors. Green is okay, yellow there is something wrong, and red calls for urgent referral. Next slide. The other component, which was at the WHO right side, is the group care. In low resource setting, the health illiteracy is significant, and many roadblocks are preventing proper A and C care. So for the women, remembering danger symptoms, adherence on advice to nutrition, how to change your lifestyle, proper use of medication, and following referral advice are all important hurdles for the clients. And from this perspective, we are combining the Check2Gether Kit with group care. And instead of the one-to-one consultation between the midwife and the pregnant women, group care is performed in group sessions with typically 10 to 15 pregnant women. Group care is highly participative, interactive, and empowering for the mothers. And it's them who are responsible for their own health status. And even they can perform the simple checks, such as measuring blood pressure. And during these sessions, the women will discuss all health aspects which are relevant at that time for them. They can also involve their husbands if they wish. The health service providers only play a facilitative role, and together with community health workers who know the mothers very well, they work together. The group care is an innovative care model that can reach high quality care during the first 1,000 days, so it can be extended to the postnatal period. Next slide.
Yes, and now I will take over. So at this moment, we are exploring to merge the Check2Gether Kit with the Myra channel of ZMQ in India. The Myra channel is an mHealth app that connects the woman with the midwife and the health center and the hospital. The woman will receive messages to inform them on the next visit, but also they get advices on nutrition and lifestyles in the form of short messages, online information and videos, as well as online games. For high-risk pregnancies, the data is shared between the midwife, the health center, and the hospital to create a holistic but local healthcare model. Statistical information is shared on a dashboard to demonstrate the impact for the decision-making units, such as the Ministry of Health and the local health directorates. To make Check2Gether financially feasible, we are exploring a light and a plus version of the kit, which is in line with the latest strategy for the WHO to scale up from 4 to 8 antenatal care visits per pregnancy and to have at least one ultrasound scan. From this perspective, the light version is dedicated for outreach at the community level, and the plus version is dedicated for the health centers. And in this health center, we are now exploring to add ultrasound to the Check2Gether kit. We are exploring the combination of Check2Gether and the baby checker from Delft Imaging, which is an ultrasound system connected to your smartphone and supported with artificial intelligence, so it can operate it by the midwife after a very short training period. The ultrasound scan will provide gestational age information and will identify pregnant-related risks such as twins and placenta previa. Although the distance to the health center is rather large in some countries, it is well known that women are willing to travel for an ultrasound scan. This gives us the opportunity to perform a more in-depth health check in the health center, and at least 1 or twice per pregnancy. From this perspective, we have submitted a proposal to develop this light and plus version in combination with a collaborative business model, where we would like to combine all this innovation with the essential stakeholders, such as the Canadian Health Service, professional healthcare organization, insurance companies, and the most important, local partners. So to summarize, Check2Gether is dedicated for the last mile solution to improve antenatal care. In most underserved areas, the healthcare system is controlled by the district health hospital, where the gynecologist is medical responsible and the district health director is financially responsible. The nurses and the midwives and the community health workers operate from the health centers, and they will perform outreach to the CHIPs at community level. So at community level, we combine the Check2Gether kit with group care to provide a comfortable ANC service and early risk identification. At the health center, more advanced risk management can be performed before a woman needs to be referred to the district hospital. And the MIRA channel connects the midwife to the woman, and it will share medical data from the midwife to the health center and the hospital. So an essential part of Check2Gether is to demonstrate the cost effectiveness of our concept. It is based on the ambition of the WHO as well as the Canadian Ministry of Health to reduce the maternal mortality rate, especially in the underserved areas, by stimulating the number of ANC visits from 4 to 8. Unfortunately, the average number of ANC visits in remote areas is in reality significantly less than 4. So we have to scale up from 2.5 to 4 and even to 8, and that will increase the cost of the current ANC model, where we have to go up from $20 in the current situation to up to $55 if we want to go to 8 ANC visits. By introducing Check2Gether and group care, we can have the same. We can have a significantly better healthcare for the same cost. As you can see in the graph, only a small part of the costs are related to the Check2Gether hardware, and most of the costs are related to human resources, which are important to boost local economy and thus the acceptance by the Ministry of Health. So group care will stimulate professional guided ANC, and women are feeling comfortable with the Check2Gether kit. They find themselves recognized, and confidence in professional ANC services can be increased. And by focusing on ANC at the community level, the travel distances can be low, so the financial impact to the woman are in a minimum. And now I go back to Lawan.
Yeah, so in summary, what is the added value of our Check2Gether? So for the pregnant mothers, as Maris already mentioned, the quality of care is near to their home, less referrals are needed, less traveling, and we hope that mothers can come there for more often and also earlier in pregnancy, which is important in all our countries where we work. With the Check2Gether, there will be fewer complications. They will be detected earlier, leading to healthier babies. And there is stronger involvement in the checkup from the mothers, and it will be empowering for them. In combination with the group care, it has been demonstrated that the pregnant mothers have increased satisfaction and better knowledge. And also through group together and Check2Gether in combination, they have much stronger social support from the other mothers, but also from their husbands. The added value for the health providers and the health system is that their performance will go up. They have improved quality of care, in screening of main risk indicators, risk factors and indicators leading to improved indicators. They are suffering from less staff shortages since the Check2Gether can be used in task shifting. There will be a reduced work pressure for the health providers because the mothers can do some measurements themselves and they can also advise among themselves, and it will also remember better. As Maurits mentioned in the previous slide, it's cost effective and even cost saving in some circumstances. And in combination with group care, health providers express that they have increased satisfaction with the care. Because they said, the mother group, what they can do together, I cannot do alone. Next slide.
So where are we now? We have performed a large pilot in 2017 in Ghana under the name of Bliss for Midwives, where we have a rugged backpack of a rugged suitcase with integrated instruments. And this project was financially supported by the Dutch Ministry of Health. And 2 years later, we have modified this rugged suitcase to an agile Check2Gether backpack with standalone devices. This study was conducted on 200 women in Indonesia and was financially supported by the Grand Challenge of Canada. At this point, we are running an EU project, GC1000, where we combine the Check2Gether with group care. And depending on the COVID situation, we will soon start a pilot in Ghana. And we have submitted a USAID proposal where we combined the Check2Gether with group care and the baby checker and the Myra channel. And also we will develop a collaborative business model there. And there we will focusing on a transition to scale, where we would like to reach 10,000 women. And in the future, we have to focus on the hurdles for scale up. So we must focus on local ownership. Check2Gether can only be a success if it is embraced by the National Ministry of Health and the local social entrepreneurs. And the aspects that we have to solve are, for instance, the availability of instrumentation, including quality assurance if local alternatives have to be incorporated by the national governments. We also have to focus on country-specific aspects like imports and legal aspects. And I think there, the expertise of the reproductive health coalitions of suppliers coalition can play a vital role. So, next slide, yes. So from that perspective, as a teaser for the discussion, our call to action is to make Check2Gether available for every mother, especially in the underserved areas. So to fine-tune the Check2Gether concept, we need involvement of local and international experts such as you. From what I know of the Reproductive Health Supply Coalition, the coalition consists of 4 main types of partners. And from my opinion, the NGOs can play a vital role in making Check2Gether part of your pilots and assist in the adaptation of the Check2Gether to the local context of each specific country. So for the suppliers, you can assist in solving the issue related to quality assurance, duties, legal aspects, especially if we have to go to more countries. And for the suppliers of diagnostic tools and for the donors, Check2Gether can assist you in a more effective way of creating and demonstrating impact. But on short notice, we need your expertise and network to scale up. And with that, I would like to thank you for your attention, also on behalf of Rudolf and Luan. And I would like to give the floor back to Milka, and hopefully Milka can present the video.
Right. So I need to make myself the presenter, and now I cannot do that. Why? Okay. Let me. I'm trying to make myself make presenter. Okay. So show my screen, and I'm going to present this video, and I hope it works.
Every year, hundreds of thousands of women and babies suffer complications during pregnancy and childbirth. Many complications can be prevented with antenatal care. But in developing countries, providing this care can be difficult or expensive. Expecting mothers may not even know they need it or rely on antiquated traditions. TNO wants to improve maternal and infant health and well-being by providing affordable antenatal care and improving the experience of care for mothers who need it most. Check2Gether was developed with partners to reduce maternal and infant morbidity and mortality through education, support, and simple diagnostic tools. Let's start with the C2G kit, an affordable, easy-to-carry backpack filled with non-invasive, FDA-approved testing materials and a smartphone. With the kit, care workers can easily and swiftly test an expectant mother's levels with minimal medical training. Using an app, the care worker can identify high-risk pregnancies and convince at-risk mothers to accept referral for follow-up care. In Indonesia and Ghana, the C2G kits have already proven successful. The second C2G program is group care. It brings together expectant mums in similar stages of pregnancy. Together, they get checkups, participate in discussions, learn to recognize and correct high-risk behaviors, and support each other. They enjoy pregnancy and early motherhood more. Together, the C2G kits and group care are saving lives in developing countries. With better education, more access to checkups, and community support, more mothers are giving birth to healthy children with fewer complications. C2G is simple, affordable, and easy adaptable to a region's specific geographic or social needs. TNO wants to bring Check2Gether to every mother who needs it. With your support and collaboration, we can make maternal and infant morbidity and mortality a thing of the past. Want to learn how you can improve maternal care and save the lives of mothers and infants in your region? Contact us today.
All right. That was a very nice video. Thank you so much.
Grammarly can help you write quickly and confidently, so you never have to slow down at work. Stay on top of emails, documents, and more without having to stay.
Okay. I'm sorry. So thank you again for this wonderful presentation. Let's see if we have any. We have several questions. So let's start with some of these questions and comments. And Hire was saying Indonesia also piloted a Philips backpack for midwives. Do you know how C2G compares with that one? I'm sorry, Maurits, I cannot hear you.
Is this better?
Yes, please, yes.
Ah, sorry, I was on mute. Yes, we are aware of the Philips system. It's called the MOM, and it also incorporates ultrasounds. It's the Lumify system of Philips. That is also a low-cost ultrasound system that is connected to your smartphone. But what I understood from the MOM, that it is focusing much more on the health centers and then especially the higher grade level 3 health centers. And we are primarily focusing on the last mile. There the cost effectiveness is of major importance. So I think that is the major difference between the MOM kit of Philips and our system, that we are really focusing on outreach and they are focusing on the higher grade health centers.
Thank you. Anne is also asking if we wanted to incorporate C2G into existing group ANC work, how do we access, procure the C2G backpack? What is the role of TNO in the rollout? Thank you for your answer.
That's a good question. So TNO and Simavi, we developed the concept of Check2Gether and we piloted, but we are not a company. So at this moment, it's not commercially available. So if it is for pilot, we can assist in providing the Check2Gether backpacks for a pilot. But if we have to scale up at a certain moment, we need a social enterprise that will be responsible for the legal aspects and also for the service and support. And we are not that far yet, but we hope to be there in the near future.
So if we wanted to buy the C2G backpack, do we have a price? Where do we go? Or it's only available for pilots?
At this moment, it's only available for pilot. So for the light version, you must think of, I'm doing it by head, but of a few €100. For the plus version, where we have to involve ultrasound and the HB device, that are expensive devices. So there the cost will go up.
Okay. We have another question here from Shafia Rashid. Does the Check2Gether require an extensive network of community health workers? Is it mainly designed for use at home visits?
The idea is that that was not really clear in my presentation, but the midwives and the community health nurses, they operate from the health center, and from there they do outreach. And antenatal care is mostly you can plan it, so you don't have to do it daily. So from that perspective, a single kit can be shared with several midwives or community health workers, and they take the backpack to the chips at the community level. And I'm not sure if it is used at home. It can be used, but it is still carried by the midwife or the community health worker. In my experience,
Maurits, it's interesting to say that we have developed also the more simple kit, which is used at home. Because of COVID and restrictions to access health services, in Kosovo, we helped the team to develop a kit for being used at home. and especially the blood pressure machine is very essential, and the urine dipsticks they can also use together with the tablet. So they can do the checkups themselves at home, and they can discuss the results through telephone or online with the midwives. But in this case, we didn't include the HB machine, also because in Kosovo, anemia is not such a big problem. And the HB machine, which is a new thing which most health professionals haven't worked before, it's also good that you need some training to use it properly.
I have another question here. Is the pilot for C2G Lite for the combination of devices, or are you still needing the pilot, the individual devices contained in the kit?
So the kit is a combination, is a backpack that contains the individual devices together with a tablet. So there is no real integration of the instruments. There is a couple of reasons. One is that we can easily switch from one vendor to another one. And if you connect it, for instance, via Bluetooth, then the devices gets more expensive. So that is why we used standalone devices and a standalone tablet. And that is for the current Check2Gether, but also for the Lite and the Plus version.
Okay, thank you so much. So in other words, have the individual devices contained in the kit already been tested?
Yes, at this moment we use validated BP machines and the urine sticks and the HB device. They're also FDA approved in many countries, so that are commercially available devices. An interesting thing is that if we go from one device to another one, that at some point Check2Gether has to be responsible for the quality of the entire kit. So that is something that we have not thought about. So from that perspective, until now we use let's say A-brand devices.
Maurits, for example, if a project would like to start with 25 backpacks for 25 midwives in 5 different facilities, how do we go about this? How do we get them? Who do we call?
At this moment, you have to call either TNO or Simavi, so one of the things that we are facing now is, can we fill the backpack locally, or do we have to fill it here in the Netherlands and then ship the backpack to the specific location? Mm-hmm. That is something that we have to figure out in the next pilot, what the best strategy is. We don't have that expertise that good, so that we know where we will have some hiccups in the logistics.
And is there an app that you have developed for the tablet?
Yes, we have an app, but it's not in the App Store at the moment. Mm-hmm. We at this moment we provide we install the app on the tablets ourselves.
I see. Okay. Yeah. Do we have any other questions? If somebody would like to have a word, they can also raise their hand. There is a little hand next to your name. I don't see more questions coming in. Here I have another question from Anne. Do you know where in Indonesia the kit was piloted?
Yes, the kit was piloted in West Timor. So that is the far south east of Indonesia.
Okay. Do we have any? I don't see any more questions. Okay. So thank you so much to both of you for the presentation. Thank you, Rolindin, for organizing this presentation. Rolinde, thank you so much for all your help. And the Maternal Health Supplies Caucus is open to more information coming in from you. And if there's anybody who wants to contact the presenters, please do so through me. I will be very, very happy to put you in touch. There's another question that just came in. Are the urine dipsticks in the C2G kit different by country to meet the national guidelines?
I don't think so. The standard urine dipsticks have these simple grades, 1+, 2+, up to 4+. What we do is in the app that we align the severity of the urine strips to the national guidelines. So we synchronize these national issues in the app.
Okay. All right, then. Thank you so much. If you want to know more about the Check2Gether, please do let me know, and I will put you in touch with the presenters today. And I'll give you back 15 minutes of your day. So thank you once again. And I'll be sending the recording and the presentation to the caucus for your information. Thank you, Maurits. Thank you, Lon. Thank you, Rolinde. Have a great day. Bye-bye.
Yeah. Thank you all.